Hello, everyone. Welcome to the Logue podcast today. Today, I am here with Mindy Eng, and we are going to be talking about all things business and dermatology related and kind of how she got into this career path. She is currently the CEO of MD Alliance Solutions, which is the management services organization for advanced dermatology that has 40 locations in New York, New Jersey, and Connecticut. I'm so excited to have you on. What inspired you to pursue a career in healthcare, and how has your role in healthcare kind of evolved over time?
Yeah. So truthfully, I think when I was 17 years old, I had no idea what I really wanted to do with my life. I'm very inspired by those who know what they want to do forever. But that said, I had an aunt that I really admired and I had a good time with her growing up. And she was a nurse. And I thought, hey, why don't I do that? And while I was doing my clinical rotations, I spent some time in the emergency room. And during my first rotation, I immediately knew that that was the place for me. I loved going to work every day and just kind of like feeling that adrenaline rush and never knowing like what was going to work through the door. And within the first few years, I was asked to join management, to which I said yes. And I think that that was a real common theme in my career path, is that whenever opportunities were presented to me, I continued to say yes. Some were successes, some were failures, but each door led to a new opportunity. And now here I am many years later and the CEO of a management service organization and working with equity-backed companies, currently overseeing multiple dermatology practices here in the Northeast.
That's awesome. Yeah, I feel like the medical field, once you get into it, there's just so many, like you said, so many doors that kind of open if you're willing to take those leaps and take those new opportunities. So that's amazing that kind of throughout your career you saw these different opportunities and were like, oh yeah, this seems like the next thing for me. And obviously, like, you have been in the healthcare space for a little bit, and it's a space that is ever evolving. So what advancements in new technologies, and recently obviously AI has been a huge topic of discussion, how has this kind of changed your day-to-day with these new technologies and advancements like AI?
So I've had the opportunity to work in various settings, from like an acute care to startup companies. Historically speaking, healthcare is a very late adopter of technology, especially when working in settings that are very established and comfortable with like the status quo. So setting stage there, I think the biggest lift that I've seen is how consumers of healthcare want their care delivered. As a clinician, as an operator, regardless of the setting or the specialty, we always start with what the patient wants and what they're kind of expecting from their treatment and their care. And then from there, it's like, how best can we deliver that? It's best is often complex because it requires integration with your current systems, end user acceptance, so especially like your employees and those who are going to be using it, in addition to the patient and what they're expecting from that. And then, of course, you have to worry about privacy and expenses that it brings to the company. However, once you kind of get all those pieces put together, you can gather a lot of valuable information and improve processes, health outcomes, and of course the cost of healthcare, and ultimately just the patient experience and how easy it is for them to have access to their care that they need.
Yeah, no, that's amazing. I feel like patient care is, with any healthcare provider, that's always going to be kind of one of the top things. It's like, how can we improve the experience for our patients? So I feel like I love that you always keep that top of mind. And going into kind of some more about patient care, what challenges and opportunities have you faced in balancing patient care with managing multiple locations? Because obviously, with more locations creates more patients, and then that creates kind of more complexity with the situation. So how have you, with the position of CEO, found it balancing these things?
Hands down, I think the hardest part of just running any multiple location facility is staffing and credentialing. So, making sure that you have the support staff that's there for the providers. And we have offices that, have multiple providers, and we have some offices that might have one at a time. So things like call outs are a very real thing. And
Yeah.
then also just working with the insurance companies. So, these companies, it's to get a provider on and to get them credentialed with the various insurances and making sure that it's, with the patient base. It takes time and it can be challenging and there can be some hurdles to go over. So I would say that that's probably our day-to-day challenge.
Yeah, no, I feel like staffing, like you said, can be just such an issue, when you have people getting sick, especially like we're coming out of winter time when I feel like, everyone gets sick in the winter. Like that's just the famous thing. Luckily, we're coming into summer and spring, so hopefully there won't be as many issues with, people getting sick and things like that, because now we get all the vitamins and stuff with the sun. And then also, so leading into kind of my next question is, I know that you said obviously the organization that you work for, MD Alliance Solutions, is the MSO, Management Service Organization for Advanced Dermatology. I know that kind of there has been some mixed reviews maybe with private equity in healthcare. What is your experience with this as someone who has worked in this industry for a long time?
So just as background, I spent the first 14 years of my career in acute care and a typical hospital environment. And I've spent the last 9 with equity-backed organizations. So I can honestly say that the same challenges exist in both settings. So essentially from the business aspect of it, we're constantly balancing, patient visits with, revenue per patient, and then with the cost of labor and supplies to obviously operate in those locations. 3 things that I can say are particularly challenging for PE is number 1 is funding. So the private sector doesn't have a safety net, so therefore when catastrophic events occur, such as the pandemic or a natural disaster, the business can take devastating financial losses and can maybe even lead to some closures that ultimately impacts access to care. And I think those are the types of stories that really make the headlines,
Yeah.
But it's a very real thing, just coming off of COVID, because, it's obviously been one of the biggest events that we've had, of late. We weren't able to serve patients. We had to shut down for various reasons. So a lot of the ambulatory care and dermatology certainly felt it, but various other, specialties felt it as well. So just having that access. Number 2 is bargaining power. I spoke a little bit to it before about the credentialing piece of it. So, and this is really the ability to negotiate payments with insurance companies, given the number of participating providers that you may have. So essentially, the more providers you have, the better chance you have to be accepted into a particular insurance. And then that also has to do with the rates that they'll pay you for a certain procedure. So I'm sure you'll see with your own healthcare, the price of what procedure you're getting done can vary from facility to facility. And rates not only, pay the provider salaries, but they also pay all the overhead expenses and the business expenses, to keep the facilities, the support staff, the supplies, and everything that's needed to deliver that care. And then the third thing is provider recruitment. While I think we're starting to see a little bit of a shift here, meaning that providers are more comfortable working in kind of a non-traditional setting, historically startups and roll-ups have more difficulty recruiting these physicians because of the life cycle of the business and the organizations. These organizations are often undergoing, persistent change and growth, and that can be really scary, especially for somebody who's coming out of school with multiple years of training and now they're going into an environment that's ever changing. It's like they finally want some stability in their career. And these environments are a lot more roller coaster like.
Yeah. No, I would say that would be scary for someone, because you're coming out of, however many years of medical school, and then you're going into a job and you're like, okay, like I can take a deep breath, finally some stability. And maybe it's not exactly, that case all the time. But then there's obviously benefits to it, like you talked about as well too. Obviously, you have a very strong business background in kind of the medical field, as well as, like you said, bedside experience with being a nurse as well. So how do you kind of approach the business side of dermatology while still maintaining a strong focus on patient outcomes?
Yeah, I think, the patient's at the core of everything that we do. So that's kind of easy for me, especially starting my career as a nurse and really always, having patient-centered care. So whenever there's, challenges or with disagreements and kind of how we're going to deliver stuff, we just try to take a step back and look through the lens of the patient and say, okay, so what is the problem we're trying to solve here? Whether it's bringing on new equipment or maybe a new vendor or what have you, like what's going to deliver the best outcome and the best ease of access for whatever problem we're trying to solve. So again, the goal is just to provide quality medical treatment that's, accessible, efficient, effective, and, delivering a great patient experience. So
yeah,
kind of defining it that way.
Yeah, just keeping really the patient at top of mind when it's like, even if like you're choosing a new technology or, like changing the scheduling system for how patients are going to schedule, it's making sure basically that that's always at the top of mind. So I love that. What innovations right now kind of in the healthcare field are you most excited for? Like, what are you most excited to kind of like introduce to your patients and to your practitioners and all of those things?
Yeah, I think there's a big move to preventative care solutions, which is exciting.
Yeah.
There's so many innovative products that are being developed and that are using technology and AI. There's so many disease processes that can be prevented or at least managed without, invasive treatments if they're discovered earlier in the stage. So I think that these types of products and the patients really being able to kind of self-monitor will really help bridge the dialogue and the relationship between the patient and the provider in the future, just so that they have more time to kind of gather and to really understand what the patient's, day-to-day and lifestyle and risk factors are like.
Yeah, no, I mean, I love to hear that because I feel like preventative care is such an important thing really in all aspects of the medical field, and especially like with our skin and stuff. That's huge because you can prevent skin cancer, different medical things. You can also prevent different aesthetic things too that are coming through in the market. And what do you see kind of for the future of multi-location healthcare practices? How do you see this kind of evolving over time?
I don't see brick and mortar dissolving anytime soon.
Yeah.
I think healthcare consolidation is kind of the state that we're living in. I think that we'll probably see more growth in kind of the multi-location, multi-specialty sector, especially with value-based care kind of really playing a larger role and what we're trying to move towards. So yeah, I think it's here to stay for quite a bit longer.
Yeah, no, for sure. I feel like especially too for dermatologists and really all doctors though, but you really need to be able to see somebody in person. Because obviously like telehealth and things like that, they're great for if you're not able to get to in person, but that in-person treatment makes it very individualized. They're able to look at you more closely. They're able to have like a real conversation with you. So I think you're 100% right with what you're saying about it's not going anywhere.
Yeah, and I think you just need a holistic approach to all of healthcare. We're also,
Yeah.
each organ's kind of interrelated and, one thing leads to another. So it's really at an advantage to, be able to have multiple specialists that are available to you, like within that network and that are working together to, make sure that you're holistically cared for.
Yeah, I agree with you. And I also think, too, if you're seeing specialists that are all kind of in the same network, too, you already have a little bit of that trust factor with them because they work with, Dr. So-and-so. So it already adds that kind of trust factor when going to the doctor sometimes can be a little bit, intimidating or so it adds a little bit of that trust factor before you even go.
It's actually better for the providers too, because quite honestly, when they have like relationships, with a different specialty, it's so much easier even for them just to like, make the phone call and say, I saw Taylor today and she had X, Y, and Z problem, and I think that she needs to see you. And this is where my thought process is, and then it creates just such a better experience overall for the providers, for the health system itself, and also for the patient.
Yeah, no, it sounds like it would make healthcare a lot more integrative because it's like you can integrate kind of the different portions of, okay, we have this going on, we also have this going on. How can we integrate these things to make that better? And what advice would you give to providers looking to expand their practice or kind of enter into the business side of healthcare like you have?
I strongly support this. I am a huge advocate for clinicians kind of joining leadership roles. I think that there's, again, it's necessary for all the innovative products and the innovation that we need in healthcare. I think traditional medicine is just not working, or the traditional way that we, system, how it was set up. So I think, having a clinician at the table, especially in, startup companies or people who are coming out with innovative ideas, because they may understand like the tech part of it and like how to deliver it, but you really need, that physician experience or a nurse or social worker, whatever the specialty might be, to give their feedback and to really help, because they know from the patient's perspective, like what they're looking for and what their challenges are in their day-to-day practice. And it's just so invaluable to it actually being successful and coming to market.
Yeah, because it is, if you can see it from all these different aspects, or like say you have one nurse and one physician, one doctor, whoever, and they're all in these leadership roles, they've all seen other things before too. So they're coming from different perspectives. So you're basically saying the more perspectives you have with leadership, kind of the better.
Like that's really what's going to drive innovation, really kind of change and shift the market. Again, coming back to the consumer, like I think that they're kind of demanding that, and that's driving a lot of the change. So having clinicians at leadership, in the specialties that they're specifically targeting is just invaluable.
Awesome. Well, it was great having you on the podcast. I'm so happy that we got to have this talk. And I want you to tell my audience kind of where the best place to find you would be, where the best place to find advanced dermatology would be as well. So if you want to give any of that information, and I'll also provide it in the show notes as well.
Yes, you can find us at advanceddermatologypc.com. You can find me on LinkedIn, again, Mindy Eng. I'd love to connect and hear more from you. Thank you for having me.
Awesome. Yes, thank you so much.